Hello, thank you for joining me in this AWS Summit online session on building cloud-based solutions in healthcare. My name is Nicky Murphy, and I'm the Head of Healthcare Public Policy for Amazon Web Services in Europe, the Middle East and Africa. Today, I will be talking to you about opportunities for healthcare systems to leverage the cloud to transform in response to global trends, and the policy environment that can help to make this transformation a success. So what are the opportunities for health systems to make use of cloud technology? First, I think it's useful to define what we mean by a health system. How health systems are structured varies from country to country, but most include the providers of the healthcare. These can be primary, secondary and tertiary providers, such as primary care physicians, hospitals and specialist cancer centres. Vendors, such as healthcare application providers, the pharmaceutical industry and device manufacturers. Government and regulators. Payers, known as insurers or commissioners. And non-profit organisations, including research institutions. Collectively, these organisations are known as health systems, and they exist to provide high-quality care to citizens, promoting wellness and keeping up with the latest technologies and trends. Globally, health systems are experiencing a common set of trends, which present opportunities for them to transform, so they can continue to provide high-quality healthcare to their populations. Even before the global COVID-19 pandemic, health systems around the world were seeing consistent trends, such as ageing populations. As we have developed better techniques and technologies to keep people alive for longer, this means more people are requiring more healthcare, and patients have increasingly complex comorbid conditions, which require more resources to support. The United Nations estimates that by 2050, as much as a third of the population in Europe could be over the age of 60. This demand for healthcare later in life leads to increased pressure, reduced access, and potentially poorer experience, with patients and clinicians trying to navigate a system which was just not designed for this many people to need this much care for so long. Transitioning to value-based care. We know that hospital CEOs are increasingly focused on transitioning from volume to value. This means incentivising providers to keep people well and out of hospitals, rather than paying on the basis of throughput. However, health system leaders are also faced with a lack of resources to implement data-driven decision-making. This is in spite of an overwhelming increase in the volume of digital data, making extracting valuable insights from the data far more complicated because of the sheer scale of information that is available. This is further exacerbated by continuous technology advances, with Moore's law stating that computer processing power doubles every 18 months. Keeping on top of these advances, and using the data at their disposal to swiftly make the best decision for the patient and for the health system, is challenging for organisations and health professionals alike. Drive to improve efficiencies. The trends I have just mentioned mean that health systems increasingly find themselves needing to innovate to keep pace with new demands and technologies. There are opportunities to release time and resources within health systems too, with reports such as the one from the OECD in 2017 stating that up to a third of healthcare spending could be seen as non-value adding. In other words, it didn't need to be spent. In the US, estimates are that up to $935 billion per year could be spent more effectively. This is a great opportunity for health systems to innovate to free up this spending, but it can be difficult for them to identify where these efficiency opportunities lie. And finally, health systems are managing sophisticated security breaches of increasing frequency. Over 93% of healthcare organisations have experienced a data breach of some kind over the past 5 years, according to Black Book research, and more than 50% of healthcare organisations have suffered at least 5 incidents over the same time frame. Health systems need to keep pace with the latest security advances too, to ensure the information they hold is kept safe. These trends show clearly that health systems have a number of opportunities to innovate, to continue providing high-quality patient care. This is the case now more than ever, with the COVID-19 pandemic presenting health systems around the world with a unique set of extraordinary challenges and opportunities. Health systems are experiencing a significant increase in acutely ill patients, constrained equipment and resources, such as PPE and ventilators, the need to keep their workforce well and able to work, and a large proportion of the population seeking health advice through traditional and non-traditional routes. Health systems are seeking to transform as a result, both in response to the COVID-19 pandemic and the longer-term trends that I outlined earlier. So, how can cloud technology support this transformation? Well, technology provides an answer for health systems which are looking to transform the way they deliver care. By making use of cloud-based technology, such as that provided by Amazon Web Services or AWS, health systems can unlock the potential of healthcare data, enable clinical and operational excellence, enable personalised digital relationships with patients, activate the healthcare ecosystem, and provide a trusted platform for delivering this transformation. I will now talk through each of these areas in turn, showing how cloud technology can help health systems to maximise the opportunities that are available to them. Unlocking the potential of healthcare data. Over 2,000 exabytes of healthcare data is generated every year. Cloud-based services provide the capability to handle extremely large volumes of data like this in a flexible way, making it easy to scale up or scale down instantly. Health systems looking to make the best use of their data must first bring together data from multiple sources, which often exists in isolation, in a way which tells the patient's story in a meaningful way for them and for clinicians. Cloud technology supports the bringing together of large data sets into data lakes, and provides the computing power needed to analyse this effectively and present it in a way that's meaningful. We saw the power of using big data sets to make strategic and operational decisions during the response to the COVID-19 pandemic. Health systems around the world used cloud technology to process and analyse large data sets from multiple sources and visualise them for different levels of decision makers. At a global level, the World Health Organization leveraged the AWS cloud to build large-scale data lakes and aggregate epidemiological country data to track the spread of the virus. In the US, Kinza, a developer of internet-connected thermometers and a health tracking app, aggregated real-time fever and symptom information to create visualizations of the spread of the illness. And in England, AWS worked with the National Health Service on a project to analyse hospital occupancy levels, emergency room capacity, and patient wait times to help the NHS decide where best to allocate resources. Even before COVID-19, Cerner was applying machine learning to historical data from a rehabilitation facility to help predict the patients at risk of readmission to the main hospital. Through this work, the health system reached the lowest readmission rate in more than a decade, and sent more patients directly from rehabilitation to their homes, a much better patient experience and better use of health system resources. We see more and more health systems using cloud technology to perform population health analytics, to make decisions about health policies, priorities, and individual care plans, as they make best use of their finite resources. Enabling clinical and operational excellence. In order to handle the increasing volumes of patients wanting to access care, and reduce unnecessary demand and burnout for clinicians, health systems are turning to telehealth and remote consultations. We saw this particularly during the COVID-19 pandemic, where, due to the large volume of suspected COVID-19 cases, many general practitioner services and outpatient clinics sought to provide consultations via video, both to meet demand and slow the disease spreading. Babylon Health uses cloud technology to provide teleconsultations and artificial intelligence-based systems to assess known symptoms and risk factors, to provide informed, up-to-date medical information to patients. Exprevia delivers telemedicine and telemonitoring of confined COVID-19 positive patients who are following the 14-day isolation at home. Another AWS partner, QDoctor, provides a video consultation service to GPs, hospitals and patients. It provides the duty doctor with a managed workflow and access to patient records to help during the consultation. Services like these, powered by cloud technology, can respond rapidly when demand starts to rise, such as during a pandemic, without needing to worry about the underlying IT infrastructure. Alongside this, when responding to COVID-19, patients are looking to their healthcare providers for information related to the novel coronavirus, guidance on when to be tested for the virus, and instructions on what to do if they have a confirmed positive result. As a result, health systems globally have quickly become overburdened with calls and questions related to the novel coronavirus. The challenge for hospitals and health systems is getting accurate, trusted information to individuals in the community and directing them to the appropriate education and care, all at scale. To help address this spike in demand for information, many healthcare organisations globally have started to build tools or technologies, such as triage chatbots, to help scale the education and engagement with the general population. These tools are designed to collect information from patients and help route them to the most appropriate level of care based on their answers. Prior to the COVID-19 pandemic, the NHS Business Services Authority, or BSA in the UK, were using a virtual call centre to manage inquiries about the European Health Insurance Card scheme. They saw the power that providing this at scale could bring. In less than 1 week after implementation, the NHS BSA were able to expand their call centre operations beyond business hours to answer calls 24/7, thanks to the efficiency of the call centre. This provided a better experience to citizens with inquiries and showed improvements in employee retention and satisfaction too. Adopting cloud-based solutions for storing health data creates its own opportunities for clinical transformation, including bringing the power of AI and machine learning to bear. Beth Israel Deaconess Medical Centre has launched a multi-year innovative research programme on how machine learning can improve patient care. For example, by optimising the schedules of its operating rooms to improve inpatient flow. The centre found that procedures were sometimes delayed or rescheduled because the required documentation could not be located in the medical record. To solve this, they now use Amazon Comprehend Medical to extract key medical terms and insights, which are then used in a machine learning model to identify the relevant clinical information. As a result, valuable time can be saved, and delays and rescheduling can be prevented. This shows how cloud technology can also help to reduce clinician burnout by providing tools which can take on some of the more routine tasks. Tools like Amazon Comprehend Medical and Amazon Transcribe Medical. This reduces the time that clinicians need to spend on updating patient records, leaving more time for quality patient interactions and patient engagement. Enabling personalised digital relationships with patients. By using cloud-supported solutions, patients can interact with their health system and their clinicians in innovative ways, which empowers them to manage their own healthcare. Last year, AWS worked with the Fred Hutchinson Cancer Centre to enable care coordination between oncologists and primary care providers. Fred Hutch used interoperable APIs to provide patients with an application to support their regimes, including appointment follow-up and engagements with multiple providers. This provided visibility into their disease progression, and this digital therapeutic approach helped improve patients' mental health, health outcomes, and overall experience. And cloud technology has helped Armada Health to roll out a digital version of its diabetes prevention programme. This digital programme can reach more people at a lower cost than non-digital delivery, and enables Armada Health to adapt the programme to individual needs, and to use data to continuously improve results. With an online intervention, participants can engage when and where they need to, even if there is no diabetes prevention programme in their area. The platform provides participants with many ways to connect in. A cellular connected scale records weight. A mobile and web application enables participants to track their exercise and meals, and they can engage with their personal coach, weekly classes, and fellow participants. Within 12 months, the average Amada Health participant lowers his or her 5-year risk for type 2 diabetes by 30%. All of this enabled by and delivered through cloud technology. Activating the healthcare ecosystem. Outside of the immediate health system, a number of partners of all sizes have technological solutions that can further enhance health system transformation. For example, the global expansion of the COVID-19 pandemic required real-time learning and collaborative work. The necessary collaboration spanned across industries and sectors and involved the sharing of plans and resources. Private sector organisations, including AWS, formed the COVID-19 Healthcare Coalition, a collaborative industry response to the COVID-19 crisis. Its mission is to help save lives by providing real-time insights to aid healthcare delivery and protect populations. Each coalition member brings its own unique assets, shares resources and plans, and works together to support those on the front line in responding to COVID-19. Cloud technology supports the bringing together of partners from multiple different areas to collectively solve the most complex health problems. And finally, providing a trusted platform for delivering transformation. Cloud technology, such as that provided by AWS, can be used to support even the most sensitive workloads, including healthcare workloads containing personal health information and patient data. AWS is the trusted technology infrastructure partner to the global healthcare industry. We offer industry-leading technology and deep domain expertise, provide healthcare-specific services, and give access to a vast network of partners. At AWS, security is job zero. It is a shared responsibility, with AWS being responsible for security of the cloud, including the software, hardware, and global infrastructure, and customers are responsible for security in the cloud, including the data, operating system, platform, applications, and identity and access management. Customers retain control of their data in the cloud. AWS provides a number of industry-leading tools to support customers to keep their data secure, in transit and at rest, including keeping it safe from the threat of cyber attacks. AWS also provides tools and support to help customers understand how to use AWS for their healthcare workloads in a way which is consistent with local regulatory and legislative requirements. These include healthcare-specific requirements, including HITRUST CSF, the NHS DSP Toolkit, ACIP HDS and HIPAA. In the UK, the NHS Digital Data Security and Protection Toolkit has confirmed that AWS exceeds the data security standards set out by the National Data Guardian for the NHS. This means that organisations with patient data can use AWS with the assurance that AWS is compliant with the UK NHS standards, as well as EU and global data protection standards. So, just to recap briefly, cloud technology is already supporting health systems to transform by unlocking the potential of the data they hold, enabling clinicians and managers to operate effectively, creating personalised digital relationships with patients, bringing together the entirety of the health ecosystem, and providing a trusted platform with which to deliver this transformation. In turn, this will support health systems to make best use of the vast amount of data and technology at their disposal, supporting them to manage more patients in a value-adding way, whilst ensuring they stay protected against security threats. These are just a few of the health systems and partners that are using AWS to deliver this transformation today. So, how should health systems and policymakers respond if they want to take advantage of the opportunities I've just outlined? Each health system globally operates within its own unique policy environment. However, there are a few conditions that we've seen associated with success when using cloud technology for healthcare transformation. The first is having a technologically enabled health strategy, which sets out the priorities for the health system to deliver, underpinned at all stages by making best use of available technology and data. This aligns health system organisations around a common set of goals and signals to patients and citizens what they can expect to receive. The second is a cloud-first policy in place, at a governmental or health system level. This is a policy which guides the controllers of data through the steps they need to take in order to use the cloud, with the assumption that it will be possible to use the cloud for all workloads, as long as the right safety measures are taken. It usually includes complementary policies about data security, classification and privacy, with clarity on roles and responsibilities. It is also helpful to set out the procurement vehicle that health systems can use when purchasing cloud services. Providing citizens and clinicians with access to electronic health data. Having a single electronic record which centres on the patient rather than around institutions is the best way to keep an accurate record which is meaningful to the patient. It can then be the single source of truth from which further analysis, identification of efficiencies, and patient engagement can stem from. This is one of the priorities of the European Commission too. However, much of this data will exist in different institutions and formats. Think about your traditional hospital record compared with your smartwatch. Interoperability of data is crucial, meaning that all of the information about an individual can be brought together and understood in a structured way. Cloud technology can support by providing a scalable and flexible platform to store and process these massive datasets, as well as providing specific APIs and tools to support interoperability, such as the Fast Healthcare Interoperability Resources or FHIR standard in healthcare. To help customers build solutions that conform to this standard, AWS is announcing an open-source serverless healthcare interoperability component based on the FHIR standard. This software will enable customers to satisfy several use cases related to healthcare interoperability, including deploying their own FHIR server, aggregating data from legacy healthcare systems, and enabling bidirectional communication with other healthcare systems. Policymakers who want to make the most of all of the rich data available to patients and clinicians should create policies and frameworks which require the use of interoperable data in an open and shareable way. And finally, having a policy which enables the secondary processing of healthcare data for research and analysis purposes, allowing data which is aggregated to inform research studies and national population-level analyses, whilst also respecting citizens' fundamental rights and complying with local data privacy requirements, such as the GDPR. Policies which set this out can enable national and international research groups to swiftly make new insights, leading to better care for our older and more complex populations, and to collaborate across borders, for example, when finding treatments for very rare diseases. Cloud technology can support with this by providing a secure platform for large datasets and a fully controlled authentication layer to control access. Putting in place policies such as these will support health systems to adopt cloud technology in a frictionless way, allowing them to swiftly get the benefits I outlined earlier. So in conclusion, it is clear that health systems are at a pivot point globally, the likes of which some have never seen. Cloud technology presents a unique opportunity for health systems to transform as they develop the services which meet the emerging needs of their populations, driven by data, value, and creating the best possible outcomes for patients. I hope to be able to speak with some of you further about this exciting transformation journey soon. Thank you, and could I please ask you to complete the session evaluation?